Telehealth and telemedicine, they are two different things, although obviously related. Early on in the COVID-19 pandemic, Governor Asa Hutchinson loosened some of the regulations regarding both. I sat down with Ray Hanley, the CEO of the Arkansas Foundation for Medical Care, to talk about telehealth and telemedicine, what's going on right now, and what's likely here to stay. What is telemedicine and telehealth? Are they interchangeable? What are they?
No, Roby, they're really not. I mean, telemedicine is encompassed by telehealth. Telehealth is a broad term. You know, it's methods to improve patient care, deliver health education, to help people with remote appointments that can't otherwise be in the office. It delivers information. There's a process to bill for the service. Telemedicine, on the other hand, is remote delivery of health care. The real-time, two-way communication. The medical information can be quickly exchanged, so it rolls up under telehealth.
What's the best use for telehealth in this day and age with what we're going through right now with the coronavirus?
Well, it can be used for any reason, but right now it certainly can be used for COVID-19. It keeps patients out of the waiting room that don't actually need to be seen right now. Their symptoms can be evaluated. It's safer for everybody.
Arkansas has been reluctant and slow to adopt telehealth and telemedicine to some extent. You think it's inevitable now?
Oh, it is beyond inevitable. And it wasn't so much the technology that wasn't ready, it was probably the payers that weren't ready, because what happened last week because of the pandemic, and Medicare changed its policies to allow the health professionals to provide telemedicine to Medicare and to be reimbursed. And prior to that change, you could only do telemedicine if you had a prior relationship with a patient, an already established patient, which didn't exist with a lot of patients. And now it's been broadened to make it a lot easier. Now Medicaid has done a really good job of opening up telemedicine for a lot of provider types. And I think a lot of that's going to still be here once this is hopefully over.
Give me a little bit more detail on what has changed, what is now more possible.
It's helped the current system in ways that wouldn't have been anticipated or talked about a month ago. I mean, the wait times to be seen literally disappear if you're doing telemedicine. The normal patients that used to fill the waiting room are gone. I mean, the doctors have lost that revenue. Telemedicine is a way to reach out, see more patients, and help put some revenue back into the practice. It helps avoid transportation issues. If you can be seen and communicate with your provider without coming in, it's lower cost for everybody. It's a chance to share information with your primary care physician that can be imparted on to specialists if need be. You can even monitor these patients from home with EKGs and pulse measures and blood pressure. With the right equipment, can all be done remotely. And I think we're going to learn to do a lot better job of taking care of chronic diseases through telemedicine in ways that we weren't prepared to do before everybody moved to learn this. And that's the biggest single thing right now is because of necessity, because of this pandemic. People have turned to telemedicine and are thinking, I need to learn to do this.
Necessity is the mother of invention, as they say.
Absolutely, so. And that's true in healthcare among many things.
Yeah. So this is part of that wave of innovation. You have heard some people say one of the good things that will come out of this COVID-19 pandemic is we will see a lot of innovation, not just in healthcare, but in a lot of different ways, a lot of different ways we work. This is clearly one of those ways of innovation. Is there other stuff that you see on the horizon that might be things to kind of be on the lookout for?
We're going to have to learn to use it appropriately for the patients that it works for. We're going to have to do a better job of finishing out the broadband, because one of the problems in a rural state like Arkansas is some places you don't have enough broadband Wi-Fi access to make this work. We're going to have to recognize that there are some patients that don't have the devices in their home to be able to use it.
Yeah.
There are going to be some that just are not comfortable using it. So there's going to be an education for not only the providers but some patients, particularly in a rural state like this.
When homemade is too good to keep at home. Helping Arkansas business do business. Making better happen with First Security.
You'll find us at the end of a lot of long country roads, covering over 60% of the great state of Arkansas. Our 17 electric distribution cooperatives are working day and night to provide reliable, affordable power to over 500,000 homes, farms, and businesses, just like yours. The Electric Cooperatives of Arkansas, your local energy partners.